Does giving your child medicine feel like wrestling an octopus? And do you dread each dosage and the battle that comes with it? Or do you have a perfectly compliant child who will actually sit there and let you administer anything to them? We always want giving medicine as positive experience as possible. And that is why paediatrician Dr. Deb Levy and I will be talking to you today with all of our tips and tricks on how to give your child medicine. My name is Sarah Hunstead. I'm a paediatric nurse and mum of two. And I'm joined together as ever with the fabulous Dr. Deb Levy. So, Deb, tell me, what are your kids like at getting medicine? Is it a joy in your house?
You're going to hate this. You're actually going to hate this because my kids are good.
That's okay. That's all right.
And you know why I think that they're good? I think they're good because I've always been very clear-cut about it, very pragmatic and very calm when I give them medication. And I certainly think that that's an important thing with kids because they can almost sniff when they can get away with things.
Yeah, that is true. I too have two kids who are quite good at this, although there have been certain types of medication that one of them has refused to take. And certainly I know your experience as well as mine in the emergency department. We have come across kids who flat out refuse to take medicine and others who will take it readily. So we've got lots and lots of experience with doing that, which we'll share with you today. We are coming to you today from Gadigal and Bidjigal land, and what we would love you to do is ask any questions or give us your hints and tips and tricks in the comments below as well. So we're going to be going through eyes and mouth, basically giving all sorts of different types of medication. So everything from eye drops to puffers to liquid medicine. But I think we should always start with the liquid medicine first, Deb, because that can be the most tricky one. So tell me, Deb, what are your top tips when it comes to giving the liquids?
Well, look, I think that the most important thing is to make sure you're giving the correct medication and the correct dose. That is the first thing to do because we don't want to be unsafe or ineffective. Exactly. So be very familiar with how to draw up medicines correctly. And I know that Sarah has some wonderful reels on this on her social media. So go and check this out because the measurement is variable with different syringes. So you have to be careful with that. But besides that, giving a child medication is usually done with a syringe, not using a teaspoon like we used to in the old days. That's certainly not accurate and as a consequence, potentially unsafe. So that's the first thing. If you're giving liquid medication, get the proper syringe with correct markings on it for the volume that you need to give. There you go. and some medications come with syringes in the packaging, and that is absolutely perfect to use. Is there anything else you want to add, Sarah, or should we go on to actually once we've drawn it up?
Well, I think there's another couple of things that we need to do as well, and that's you certainly talked about the correct dose and the correct time and so on and the correct medication, but we also need to make sure we've got the correct child. And I know that you're thinking, hang on a sec. Come on, Sarah. Seriously, that's just silly. But it's not, especially if you have, a tribe of children and you've got multiple kids on medications, make sure that you are giving the right child the right dose and their medication at the right time. Double check every single time, because what happens if, you've got 4 kids, 2 of them have got a fever. You're giving, paracetamol or ibuprofen to both of them. They're at different times. They're 2 different size kids. Always, always, always double check every time. And even if you're only giving medicine to one child, make it a habit. And I probably should have saved this till last, but I'm going to roll now, Deb, so I'm going to keep going. It's really, really important that every time you pick up that medicine bottle, that you read it again. Whether it's, being dispensed by the pharmacy, making sure that you are checking that dose, even if it's just, an over-the-counter pain reliever like paracetamol or ibuprofen, you read it and you check that dose again and you check the time. It is so important, especially in the middle of the night, okay? I do it every single time, and I'm sure Deb does as well. So always, always read it again.
Okay, great. So I guess the next step then is actually getting them to take it. Look, I think, I think a wonderful thing to do is actually to get your children comfortable with syringes when they are healthy and well. In other words, medical play, that's the terminology that we use. And, I'm not suggesting you're giving them medications to play with. What I'm saying, though, is, maybe give it to them in the bath so they can play with the syringe, or even better, give them something tasty to drink out of it. It can be a game, sucking it up in the syringe and squirting in their mouths, so the fear of the syringe is taken away. And that's the same with all other, and that's also the same actually with the puffer, which we'll talk about, but it's really about removing one potential obstacle or barrier. So then I guess, you've done all the right things, you've prepped your child correctly, but now it's actually giving it to them. So, this is going to be age dependent as well, which is why I hesitate. Older children, let's say my girls are now 5 and 7. I just say to them, because they take supplements. So, I say to them, open wide, and they either squirt it in themselves or I squirt it in for them. And that's it, and it's as simple as that. Obviously, that's an ideal situation. Younger children, you can't communicate that with. And some children will just go. And we've seen that, Sarah, as you say, if it's not on our children, it's in children we've looked after. And I've seen a whole lot of techniques implemented to try and get children to take things. Some a little more gentle and some a little less gentle. I think that obviously a gentle approach is better, because what we don't want to do is make it a negative experience for your child. So then it just becomes worse and worse and worse. So a simple way is, and Sarah, I don't know if you want to talk through some of them as well, just interrupt me whenever you want. But I think for the younger babies, and I've got my highly compliant child here who does whatever I wanted to. And I don't have the syringe here. I should have actually brought it. It's in my bathroom. But I think just cuddling them, and you can even just give them small little sips as they go. It doesn't have to be one whole big squirt in one go. And if you just dribble it into the side of their mouth, sometimes they're less likely to spit it out. And something as simple as that may just do it.
No, I 100% agree. And I think, Deb, what I can actually show with my longer armed baby here as well is the fact that we can actually tuck that arm under our other arm there. So you can see that at the back, we've got that there. So the and you can hold on to their hand. So if you've got that baby who's reaching up and wanting to grab you and all the rest of it, or not wanting to be compliant, holding their hand and tucking that behind, and this works really nicely for toddlers as well, is a really great way of doing that, and doing that teensy tiny little amount at a time that goes down. Now, Deb, were you about to mention as well that little babies about the little puff of air into the face? Were you going to have a chat about that too?
You mean to get them to open their mouth? Yeah. So you carry on, Sarah. What we want to do is get them to voluntarily open their mouth. I have seen some people block noses to try and get children to open their mouths, and I would generally advise against that, again, because it just becomes unpleasant. But as Sarah was saying, a gentle puff of air into their face. If you want to demonstrate, Sarah.
Absolutely. Okay. So, I'm just going to get into the right position here. So if you imagine we've got our syringe and we pop that lid, if they're, mouth open and so on, we can pop that tiny little bit in the side there, and then that puff of air, that just a little firm blow into their face. What happens is you'll find that they will blink and they will swallow, and that little bit will go down. So rather than filling it, their whole mouth up where it's going to come dribbling out, their tongue is going to push it forward, just do that tiny little amount down the side of the cheek, and they will blink and swallow, and then ready for the next bit. The other thing you can do is actually pop a dummy in their mouth as well and pass it down the side of the dummy. And there are, you can actually buy medication devices. medicine dummies where you can pop the dummy in and the syringe actually goes into the back of the dummy and you can pop it in that way and they'll suck it down. So that's a good way of giving oral medication to little babies. So what do you want to add to that, Deb?
I think for older kids, they won't take it straight. The first conversation I would have with your healthcare provider is, can I mix it with something? And the majority of medications you can actually mix with something, whether it is, something like a little bit of honey, again, this is for older children, or, a little bit of juice or whatever it is that your child will enjoy the flavor of. Because a lot of the time, it's actually, it's the flavor, obviously, of the medicine that children don't like. And that's also worthwhile exploring. Is there a different brand that's got a different flavor? But bearing in mind that the majority of medications are flavored because the medication itself tastes disgusting. And I know, like paracetamol, for example, I've spoken to compounding pharmacists before about maybe having an unflavored version for some of the particularly challenging children, and they've gone like, no way, you don't want to do that because it's really, really unpalatable. So I think that's a good way to do it. And, so you can kind of like chase it with something that they like as well. You can mix it with something that's a treat. Just so again, making it more about making it more pleasurable as opposed to more painful than it has to be. Sometimes also again with older children, they may actually be ready to learn how to swallow like tablets. And I think it's worthwhile, again, exploring that with your child. There's a great video, Sarah. I'm sure that you've got the link that you'll post. Thank you very much.
I do. It's a paediatrician who is a researcher at a university in the US, and she has a technique. You have to dedicate 12 straight days to doing it that teaches children how to take medication, and she has a 100% success rate as long as you stick to the entire program. That's the thing, a 100% success rate. And so I will put the link to that in the comments below, but it does take time in investment with that, a lot of investment of time, but it's well worth it. One of my children is on a regular medication, and unfortunately the right dose isn't in tablet form. So she has to have it's the tablet, but crushed up.
Yeah.
It is the foulest, most disgusting thing you will ever taste in your life. And she was refusing to take it. She's older. And so I realized that control is often something with the older kids, even toddlers, by giving them choice. And so it may well be, do you want to have your medicine? You have to have the medicine. That's not negotiable. But how do you want to take it? So do we measure it out and then pop it on the spoon, and you want to have it off your favorite spoon, or you choose the spoon, as in your child chooses the spoon, or do you want to have it in a cup? What do you want to have after it? Do you want to have if it's okay to have with the medication, a spoonful of yogurt or a sip of juice? And realizing with my daughter, I let her choose what to mix the medication in. And what we found that masked the flavor for her is that we used just half a ml of maple syrup, that disguised that. And then she's like, yep, I'll do this. So she knew it was not negotiable about having it, but we workshopped together. And the other thing too for her is that she wanted me to know how disgusting it was. So I tasted it. I agreed with her that it was absolutely foul, and that made her feel better. So that was one thing that she needed. Not that I'm advocating trying a children's medicine, but I simply just, tasted a teensy bit of it to show her that I understood it was disgusting. So there we go. So it's about choice as well. So we've talked about the oral medication. Any other tips that you want to add to that before we move on to another type of medication, Deb?
Other than to say that there are still going to be some children who just point blank refuse, and you're just not going to get it in them. Then it becomes about, well, is there another route we can give it in? Whether that's something at the bottom or something through the skin. That's something that you need to discuss with your healthcare provider.
Yeah,
there often are other options.
Yes, and there are also other things that you can do as well. For example, there are lots of helpful videos on the Sydney Children's Hospital Network website. You can actually speak with one of the child life therapists there who may be able to help with a program, especially if your child needs regular medications. So there are resources out there for you as well to help with that. So, Deb, we've talked about giving oral medicine. We would love you, if you've got any special tips or tricks, please pop them in the comments below as well. But Deb, what about puffers? Do you have any tips for giving puffers to kids?
Look, I'm bringing a puffer here. Look, I'm not going to go through the whole, checking the medications and date, because I think we've covered that, and that you're giving the right medication. What I will say the difference, though, and this is just standard salbutamol or Ventolin. What I will say is, don't forget to shake it with this one. And if it's the one that's got a counter, don't forget to check that there's actually some in it before you start giving it, because you obviously can't see in it.
A very important thing, Deb, that you didn't mention, but you did, take the cap off.
Yeah,
always
sorry.
take the cap off.
Take the cap off. I think I'm just trying to, there were a couple of things I was going to say now. Sorry, now my train of thought is gone. Look, I guess the first thing I want to do is just say that what this is. This is a spacer device. The reason that we use it with inhaled medications is that it actually improves delivery of that medication to where it needs to go, i.e. your child's lungs. Children are different from adults, and this allows it to get breathed in correctly and not just circulated in the mouth and then breathed out again. The other important tip is to have a very clear plan as to how many puffs your child needs, and I'm not going to go into that today, but just to comment that every one puff needs around about 4 breaths, give or take. Again, that depends on your personalized asthma action plan. Depending on the age of your child, most will actually still require a mask. And the important thing about mask, obviously, is that it's flat, is that it's soft. It can cover both the nose and the mouth. There's no point in squirting something in a young child when it's just going to escape out. And I just want to stress again that it's important to get your child accustomed to what this is, because, and I'm sure, Sarah, you're going to echo the same memory in that you will, when child comes in and they're struggling to breathe, they're in a state of panic.
Yes.
And when you then stick something over their mouth, they don't understand that that's medicine to help them breathe better. And they fight it and hate it, and they get more frightened. So I think it's a very valuable thing to make sure that children are comfortable putting it on and off their face.
Yes, most definitely.
Some of these spaces will need to be primed, which means they need puffs in it before you use it. Some of them won't, and if you're in doubt, please chat with your pharmacist where you purchase the puffer. The one that I have here is an anti-static spacer, and it came exactly in this package here. Sometimes you have to buy masks separately. They come in different sizes and different shapes. So giving that, obviously, you have to make sure it's pushed in properly. Then it's about positioning it on your child. As I said, you want to cover, this is slightly big for this child, because what you don't want to do is overlap around the chin too much, otherwise you're going to get air leakage here. Again, there are people to help you with this, either your own doctor or the pharmacist. You want to place it over the nose and mouth. As I said, this one is a little bit big. This baby would probably do better with just a simple round one. And then, now this is where Sarah is also going to come in handy with her doll, is I think the easiest way is to hold your baby on your lap. Angle it down a little bit like this. Can you see okay? Yeah. Hold the baby on your lap like this. So you've got their head against you, and then you can squeeze it. So you've got control. Can you see that? You're holding it with some degree of pressure, and then you can squirt it. I'm kind of just inherently, like, naturally holding the my baby baby's arms here. Obviously, this is a totally immobile doll, and it's not a wriggly child. So I'm totally aware that things may not go according to this plan. But and you may actually need another person. You know, an older child, you may need to put their legs between your legs and then cross your legs over. But you know, this is often the easiest way to give it to your child. There are many other ways to hold your child. Again, you can hold them in your arm, like Sarah demonstrated, one arm underneath, one hand here. You know, but I think that this is a bit trickier. Sarah, do you want to, because your doll is a little bit more anatomically correct.
We've got arms here.
Yeah, absolutely. Do you want to show the other techniques to hold?
Yeah, I think the way that you've had that baby first, because one of the things that, you know, particularly we don't want them to do is pulling their head back. That's the one, that's the aim of it, is that by keeping them against you, you're not going to do that. Certainly, I love the hands in front like that, keeping their arms down, and then you've got the ability to do that. One thing that with Deb's spacer, that with the mask that she's got there, is that it's not a collapsible mask, because with the collapsible masks, what happens is it's really hard to keep them on their face. But if you are choosing to do this with your legs over the top, if you've got a mask like what Deb has that's the silicone mask, you can actually use the one hand, because you've got obviously their hand in this one, and you can pop that on their face, and you'll be holding above, and the mask will be fine. You'll be able to really control the medication giving it like that. But if your mask is one of the floppy collapsible ones, you're not going to be able to do it if they're wriggling around. And so having one of those firm silicone ones is definitely advisable as well. The other thing that you can do too is that if your child is one of those ones who is just not having a bar of it, you can sit with them like this and get them to reach for the stars. So we call it, you know, we used to call it reaching for the stars, where you would actually hold their arms above their head and then give the spacer down like this. You can also do that on the floor as well, with their arms under their legs. But you've got to turn it into a game. You know, we want to be reassuring and everything throughout. And certainly, you know, being in the hospital, I remember kids who would freak out having that thing close to their mask. I'd pretend to give it to mum or dad or grandma first.
Or whatever, yeah.
Or Timmy, just pretending first. And so then they would have it, and then the child would have it, and there'd be, afterwards, you'd be going, yay, well done, you know, and that reward of a sticker or something like that afterwards, knowing that they have to have it and that they did really well by having it, I think is an important thing.
The other thing, the other point I just want to make when you're giving spacers, puffers, is the reason that we use it is to give them, and the 4 breaths is for it to actually be delivered to them. There is actually a valve inside there. So once you puff it in here, which I will do. There you go. They then need to breathe in order for that to go through to them. So ideally, I think it's best to keep it on their face during that time, if they will allow you to. But if they're moving around, just pop it back on for that next breath.
Absolutely.
Sorry, carry on.
And remember to shake the puffer in between each dose as well. That's really important.
Yeah. You don't have to take it out. You can just do it like that. Okay. And just make sure it's still squirted in. I think I'm trying to think if there are any other ways to hold. Obviously, if you've got 2 people, it makes it a lot easier, because then one person can hold, whether it's, you know, the arms up version, or, you know, across the body, or in whatever way. And, you know, that kind of a hold is if a child's throat is being examined. And then the other person can pop it on their face. And that's what we used to do as a team in emergency. But I think we've covered everything with puffers. What do you think, Sarah?
I think so. I think we have. Should we talk about eye drops?
Sure.
Okay. So with eye drops, I don't know about you, but I hate having eye drops. And I think I just don't like it. It's just one of those things. I just don't enjoy it. I do it. I'm compliant, but I don't enjoy it. And certainly my kids have had to have eye drops in the past. And Deb, I might get you to talk about the eye creams, but with the drops, I was told some really great tricks by an ophthalmologist to try and get kids, particularly who have to have regular eye drops, who just are not compliant. Holding them the ways that we've already talked about. It might be arms up, it might be, you know, holding like this, or wrapping, you know, things like that. But forcing your child to open their eyes if they're not going to open their eyes is awful. There's risk of you injuring them when you do that. So one of the things that we can do is always make sure, and I'm just using, this is a nasal spray, but I'm using this as an example here. Okay, so this is not, I don't have any eye drops in the office here. So really important that we don't touch their eyes or surrounding skin, and that's very, very important. Certainly, if I needed to give 2 drops of this medication, then what I could do, their eyes are closed tightly shut, I can't get in there, I'm simply going to drop the required dose, so I don't know, 2 drops into the corner of their eye, and as they open their eye, they will blink and the medication will be dispersed through their eye. This is next best thing. You know, there's still, you know, it's better if you can have your child's eye open and you move the lower lid down and you drop it in there. That is the ideal situation. But if you have a completely non-compliant child, then dropping the dose in the corner of the eye and then having them open their eyes and blink is the next best way to do this. Being careful of as well, though, that if they're tossing their head around, that the medication isn't running into the other eye or anything like that. So being careful to hold them still as well is important. Now, any tips on cream medication for eyes, Deb?
So eye ointment is typically prescribed to much younger children. The reason being is that it'll often make their vision blurry, which is obviously quite distressing for older children. So, you know, I guess the most common would be the antibiotic one, which you can get in drops or ointment for a conjunctivitis and eye infection. And I think it's a lot easier to put in than eye drops. Because all you're doing is, you know, you're pulling it down and you're squirting in, like, on the in that lower lid area there, like a 1 to 2 centimeter amount, and like a little worm, and that's it. And so I think it's a lot easier because there's a lot less wiggling and stuff. So there you go.
Yeah, no, absolutely. And I can remember when my children were toddlers and needing that particular medication, that they were looking forward to it because the cream or the ointment felt nice when it went into their eyes. So, yeah. And, you know, I guess that's the thing too, is we're not going to lie to our kids about giving them medication. It's not negotiable. You have to have it. The reason you have to have it is blah, 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 blah. You know, it will make you better. You need to do this, but give them the choice as to the how. You know, they need to have some control over something. Now, Deb, is there anything else that you wanted to talk about before we finish up today?
Not that I can think of. I'm happy to take any questions if there are any, but I think that we've covered everything.
Yep. Okay. I think we have to. And remember, everyone, if you think there is some valuable information in here, which we certainly hope you do, please tag people in the comments below who you think will benefit from this good evidence-based information. We really want you to do that. And we'd love it if you came and visited us on our Instagram pages as well, because we've got lots of really good health information on there too. So, Deb, I don't think we have any questions today, so we might wrap up. And we don't have a segment for you next week because I am in the midst of moving house, and so it's very exciting. But I will be up to my armpits in boxes, so not next week, but we will be with you again the week after. Okay.
Wonderful. So remember,
thanks everyone, and send us what you want us to talk about. See you.
Definitely. Bye.